hear me?
Okay, I'll take a motion to approve the agenda.
So moved.
I so move.
Discussion? Approved? All in favor?
Aye.
Opposed?
Aye.
Take a motion to approve the minutes from November 8th. So moved. Second? We can't move too fast.
Yeah, I tried to get in.
Some smoke coming up.
Time.
No great shorthand.
Okay, and discuss all the minutes. Okay, all in favor?
Aye.
Opposed?
Aye.
Public comment.
Amy, can you hear me all right?
Public comment, anyone in here? All right, receipt of information from supervisors not seated as committee members. Anybody online or?
Good morning, Amy. Can you hear me all right?
John's on there, so make note, John Bonner is here. And, John. Okay, number 6 is an update on homelessness and unhoused.
Yeah, I'll just give you an update. I know Ryan heard this yesterday. I spoke with the General Government Committee last month and again yesterday. The topic of housing has come up throughout the county, and I think it's one of those where most of the supervisors at one time or another has called and said, hey, we need to do something about housing in our county. What we're finding out is that's the same thing that every county in the state is hearing. So the idea of a task force being created was brought up. Ryan and Brad Olson are a couple of supervisors who've already said, I'd like to help in any way. I talked with Terry Hauer. I spoke briefly with a few other people in the community to get their ideas. What I also did is contact the West Central Regional Planning Commission, and they have agreed to help me identify the various types of housing programs, all types of housing going on in the state of Wisconsin and in Minnesota, I think is where they're looking initially. But the whole idea is my thought is, rather than jump into, here's an idea, what do you think of this one? Let's get a kind of an index of the various things that are going on. Then we can look at those, study them, and then tailor it to what might work or be appealing here in Polk County. I did just get an email yesterday afternoon from the Regional Planning Commission that just sent me some initial things they found, and I haven't had a chance to review it. But they're looking at it for everything that might be considered low-income housing, workforce housing, homelessness, sex offender homes. I mean, they sent me examples of things throughout the state. So we'll look at all those things. The timing is such that we can begin discussing this as we get some ideas here. And my thought is, because it's such a diverse subject, in terms of what type of, I mean, we're not going to be able to do all types of housing for everybody, but it's probably something that when we get into our April priority setting for the board, we can really March and April start drilling down as to what exactly we want to target with. Now, as Jay has said too, it's not like we can only do one type of housing. The concept that seems to keep bubbling up in my mind and as people I talk to is the county is not, the core principle of the county is not to provide housing. So we don't have the Department of Housing to help with this. So, you know, we're kind of grabbing some staff people working on some ideas. We also don't have the funds like ARPA that's going to, you know, that's not going to be coming to us anymore. So the thought being is, how do we set up a mechanism to assist local communities that want housing or want to support development in their communities? And that way, that community might say, we need senior housing. Amory may say, we need apartments for young people because we want to keep our young people, and they start working here in our businesses and they can't get away from their parents. So they're looking for apartments to get started. Now, these are the conversations I've had ever since my EDC days. So the county, the thought being the county may be able to provide some type of incentive, financial coordination, planning, even generating ideas, providing some type of leadership to offer that incentive to a community, because it's really gonna be the local community's responsibility. They're gonna have to decide, we have the land, the location, we have the need for our businesses. They're gonna have to deal with the infrastructure, and and their citizens. So we think that may be the way to go. I don't know if you have any questions or ideas.
Is that a committee sort of thing, or what do you think?
Haven't created it yet, and I think it's gonna be more of a task force that would, I wanted at least a couple of supervisors. And to be honest, I haven't established it yet because, I'm getting different ideas. I can see where every community might say, I want to be on that committee. We got to understand what type of committee or task force we're trying to create, because we don't want this to become an all-out food fight for, we want something in our community, I don't want to help that community. So we may be looking at, maybe a local politician or maybe a local administrator, organizations that are interested in housing. So first I thought, let me get kind of the index of all the different types of programs, and we can start rolling that out to the GG committee and this committee, and see if we can start to narrow that down a little bit.
So when we had, so last month, I made a comment about how I felt about Amory's public housing. And that I think it likely is a model. I mean, we could, yeah, I mean, there's 6 or 7. I mean, I can't remember how many people we house in this town, but it is a lot. It's in the hundreds. There are several facilities, housing facilities that are run out of the lady, I can't remember her name. I always mention the skyscraper in town. Remember her name? That's where her office is. And that's the hub.
Yeah.
I mean, that is, she's the smartest person in the county.
And the name,
On local
what's
town.
the name? You don't know. Okay.
Can you get it to them?
I can't.
Yeah.
I can't.
Um,
So if
and
every town has had or needs something like that, and it is not, like you said, if you get everybody trying to invent their own wheel, that's just stupid.
Well,
Because we'll be here for years and years trying to figure something out.
yeah, and that's really each community to decide what exactly it is they need. And maybe Amory says we have enough public housing, we need
Let's do a
something
tour
else.
and show you what we got here
Yeah.
and how you do that. And then Chippewa, they're doing amazing things down in Chippewa. They're turning out their old schools and old, businessy kind of buildings into single apartments, and there's a homeless development or
Well,
house.
so there's things that we can do. So yesterday I reached out to Village of Milltown. I got put on the next agenda for the village board meeting. And we're just gonna have a discussion about where do you like, that's something that hasn't been in the conversation that has now kind of been included as something really important in the conversation is community buy-in. Because if we sit and, plan everything around this stuff and the communities have no idea what's going on, then we're not starting off on the right foot. For one thing, that won't be effective. But,
Yeah.
So if I talk to Milltown in January and, they tell me like, here's the things that the buzz that we've got from developers that are already trying to build this or that, here's what we think we need, here's what we don't want, anything like that. So we can collect as much information as we can. I'm gonna get on the ball some Lake one too. I just gotta reach out to them today. So I like the community buy-in aspect of it, because then you're kind of starting the groundswell right away.
Mhm.
And that's where Amory has, the expert in their backyard, Amory's gonna have different motivations, needs and things like that. They might say, hey, whatever program you come up with, we'll use it in this way. Other communities are gonna use it differently. So I think we're not trying to fit everything, but we're trying to make something available to everyone. Along the right.
That's the idea.
Right, it's a start, Brian, and I think that it's gonna be more than what we have here. it's gonna take creativity. And I see what they're doing in Chippewa as in like out of the box kind of stuff.
Yeah, I would like to do a field trip.
Okay.
To Chippewa with anybody from this committee particularly, maybe a larger board, but this committee, just to, head down and take a peek at what they're doing. I've heard the buzz from folks at West Cap also about some of the stuff that's happening there. It's very innovative and really outside the box and really interesting. And
I did connect with Jessica Olson Blue. She is
Yeah.
the housing authority manager down there, so maybe we can
Yeah.
get with her and if they want to do a field trip.
I can
we
see
can
it
go.
every weather.
for
I
driving.
see them.
Jessica Olson Blue.
No, you talking about the lady?
No,
we're
no,
talking about
that's the Chippewa
Chippewa.
authority. I'm trying to find the link out there.
Vince, one thing to think about when we get for however we put this steering committee together is that I like what we did with PTAG and that we kind of didn't do the food fight thing. We didn't, it's not an either or, I win, you lose. So as long
Here's
as
the
we,
goal.
yeah, and so Don can put his brain on some of that sort of structure of how the process works and how.
Right.
That would be good.
And
So everybody gets something. Rita, come join us, come on up.
I like the idea of the fact that for anything to work, like PTAG or anything else, you're gonna have to get buy-in from all the supervisors. And right now, supervisors have divergent, going back to you saying housing needs, we got about 7 or 8 different answers. And so I think,
Personally, I'm sorry to interrupt. I don't think we have a divergent view on what housing is. I think we have a divergent view on what the end goal is. Because
Right.
it seems like one plan is, moving forward, all this stuff is behind us. Like the plans that have already come up are behind us, which is good at this point. So whatever we come up with moving forward is going to be, like you said, a broader vision of everything. I don't think that we have different views on what housing is. What we've had different views on is the goal to get something done with housing or is the goal to get paid money? Like, because it seemed like this last plan was the end goal that we're working towards and structured everything around was, are we going to get paid back? Or the other one was, we're making an investment, we'll get paid back in multiple. And I think that's where like the divergent or where we hit that cross or fork in the road, and now we're bringing it back together. So I think everybody recognizes that we have needs at every level of housing, but it's the part that.
so getting buy-in from all the supervisors or
Yeah,
the
because
majority of them will help.
right, it just seems like the philosophical viewpoint. One is the money-centered one, which is not bad. Though. You have to be smart with what you're doing with your investments. The other one was admittedly more loose with what we're going to do with that money and assuming that we're going to get a return on that investment over time. So I think that's where we're having to come together is, like, are we super concerned with making sure that we're paid back immediately, or are we concerned with investing the money and getting the return, not just on payments back, but from the effect of housing being built and providing that service and the effect of that existence.
Anybody else?
If there's another room for another supervisor, I can fit in that,
Yeah.
whatever that group is, and fits well with my board responsibility with West Cap.
Yeah, you have the first motion.
And they're doing really great stuff, and so I can bring, be a conduit back and forth, I'd be delighted.
Okay. As we start to take shape on.
Okay, thank you. Okay. Okay, number 7.
Well, welcome to Golden Lake Manor. Yes. So I'm Diane Reeves. I don't know if everyone knows me or administrator here for the past 11 years. So time just flies. So So yeah, welcome. It's been a heck of a couple of years here for us and as it has been for everybody, but in our industry especially. So, not knowing what everyone knows or doesn't know about Golden Lake Manor, I'll just give you a little background. So currently we're 85 bed facility here. That's gone down over the years due to some changes not structurally, but kind of where just kind of overall changes. So when I first started 11 years ago, we were 114 beds. We've decertified a couple times since then. One of the big changes when COVID hit is that we were to have a designated COVID area for any patients that may be needing care if they're positive for COVID. So our building is laid out and such, and I'll just say if anyone wants a tour afterwards, I'd be really happy to do that. So we have basically 4 units. We have an east wing, a west wing, a north wing, and then a special care unit. The special care unit, Judy's Cottage, was built in 1997, so that's our newest area. That's our secure dementia unit. And then our north wing is what we decided when COVID came, that's where we were going to have our COVID unit. So we took all the residents off of our north wing and distributed them throughout the building. And we did have to use our COVID unit a couple times, but not until October of the first year of COVID was the first time we had to use that unit. It's been sitting empty now for a long time. And now due to staffing issues, we are able to restaff that area. So we've just left it as is. So again, 85 beds. Right now, we stay right around the 60 mark, whether it's 58, 65, that's kind of our normal census these days. And that is driven basically completely by staffing. If we had a full staff, we could, we could have more residents, but we don't. And that's kind of, our philosophy. We're not going to take residents. We can't take care of them. Which seems obvious, but that's not how everyone operates.
Yeah.
So,
Thank you.
yeah, so we try to, keep our standards high and our quality of care high. So we are turning people down almost every day, which is, I really breaks my heart because some of those people are from our communities or aren't from Polk County. Some of them aren't. Some of them, literally we are getting referrals from, you name it. It's a huge area that we're getting referrals from, which we know these social workers are casting their nets and saying, please, somebody take this person. They've been in our hospital for, 75 days or, maybe some more, some less, of course. But that's the huge issue right now in long-term care is the lack of staffing to take care of the folks that then have to go home or they have to stay in the hospital. They're taking up beds there. We'd love to take them, but we can't, we won't if we don't have the means to take care of them. So that's a struggle, but it is daily, weekly that we're turning folks away. So that's kind of our overall, we take everyone from short-term care, long-term care, Alzheimer's care. We have some beds designated on our east wing for that short-term rehab. So those folks that come in that maybe have a knee replacement, a hip replacement, a stroke, any sort of recovery where they're trying to get home. Then they have physical, occupational, speech therapy here. And they may stay 20 days, they may stay 100 days of their Medicare benefit. And then we have care folks, and then we have special care unit. We have some, some people with Alzheimer's throughout the building, of course, but those people that maybe have wandering or behaviors, things like that, they're in Judy's Cottage. There's 17 beds up there, which typically stays full. We had a couple deaths. We have a couple beds up there right now, but it doesn't take long for those to fill up because we're getting calls from other facilities. We have so-and-so, they're wandering, they need a secure place, which is, comes with its own set of challenges for regulations and behaviors. And you have to sometimes you have to be careful to get the right personalities together back there because sometimes, behaviors can really cause that unit to struggle in terms of, cohesiveness, I guess. So that's kind of as far as residents go. Staffing, of course, like I said, is a huge issue that we've been working on throughout most of the years that I've been here. But of course, most in the last couple of years, it's amplified with the jobs out there that folks can get that don't require, taking care of people, doing their personal cares. And it's a hard job, especially that of the CNA. They can go work at Quick Trip or McDonald's or Walmart, stocking shelves and make more money than working here. So that's really hard for us, because unless you have that heart for caregiving and this is your passion and this is what you are called to do, you're going to choose to go stock shelves at Walmart overnight instead of taking care of the folks here and doing their very intimate personal cares. So we, over the last year, we have increased our wage scales for our direct care staff. We hired a nursing recruiter here. She's working part-time. She's trying to help us get some new avenues of, advertising and bringing folks in. We're part of the WIS Caregivers Caregiver Program. That's through the state of Wisconsin to encourage folks to become CNAs. They pay for the training. They get a $500 retention bonus from the state after 6 months. We've had pretty good luck with that program, but it's about 50-50. They're high school students, which we love. We love our high school students, but another wonderful rule here in the world of long-term care is that they can't use our mechanical lifts until they're 18. So if you need a full body lift or a stand lift, those folks can drive their cars here. They can be out on the roads with all of us. But once they get here, they can't push a button to put somebody in a chair or in a bed, which is an OSHA rule. It's been there forever, as long as I've been doing this. So that's always hard because they can't do the full workload of a regular CNA, because we have a lot of people that need those lifts to get in and out of bed and in and out of their chairs. So, but I have really good luck with some really awesome high school kids, and they're usually the kids that are in all the sports and all the band and all the everything. So they're very busy, but we love them and we will take what we can get from them. And then we do have a number of folks going through the WIS Caregiver Program. I actually have two gals, adults that are coming in today to take their CNA testing at noon. They just finished their classes, so once they pass their test, then they can come work for us. When COVID hit, there were a lot of rules that we got to kind of fast track the training, and they were able to work before they tested, which was really nice, because in our area, the testing is really hard to come by. People are having to travel across the state to take those skills tests. And, personally, I think they were getting just as good a training. They were, we weren't cutting any corners in terms of the care and the skills that they were using. But all of those rules have gone away. So we are now having to wait until they're fully certified to work here. So the process is a little longer. But we're working through that, trying to get as many people interested and into the field as we can. Back in May of this year, I started working on some international recruitment, which I know it's called International Manpower. They've been around speaking to some of the economic development groups throughout the year as well. So we're kind of in the throes of that, working on getting some Filipino workforce here. They say it's a 2-year process, but then they also say there is a way to fast track it. We're not to the fast track part yet, but we're just kind of going through the process of that right now. So if you haven't heard about that, I can talk more about that too, but that's exciting. Currently, to also remedy our short staffing, we have hired traveling staff, which they come for like a long-term contract, usually like 13 weeks, from all over the United States. Sometimes they're only from a few hours away and they're still traveling staff. Sometimes they're from Alabama or Texas and they come and help us out. Of course, that cost is higher, comes with the cost, but that has helped us get through. And luckily for our licensed staff, our licensed nursing staff, our RNs and our LPNs, as of right now, we are just about fully staffed. We had 2 gals just within the last month. They both had worked for us as CNAs in high school. One was a CNA. She got her RN. She moved to Woodbury. She was working in Minneapolis at a big hospital. Her husband's a pharmacist, and they decided, you know what, we're moving back to Amory. This is where we want to raise our family. This is where we want to live. So that was really exciting. So she took a full-time position with us, and she's commuting from Woodbury right now, but they're building a house here. So that's really exciting. And then we have another one who's a CNA here. She moved away to the cities, went to nursing school. She got her RN, and she just moved back between Amory and Osceola to live with her fiance. So she just took a full-time position with us as an RN. So that was really exciting. 2 gals that worked here, starting when they were 16, that just, came back and just feel like they're at home when they're here. So that's been fun. So luckily, what we do have, like most nursing, We have quite a few nurses on the end of, getting close to retiring, with, not as many to fill, to, take their place. So we continue to try and, recruit people into the profession and, we have some of those long-term care nurses out there. Questions? I guess that was a lot, but any questions for me?
Do you have any, are any of the young people that work here, are they students through youth apprenticeship?
Yes, good question. We have a lot of youth apprenticeship students. Yes, we have through Amory, Clear Lake, Turtle Lake, Clayton. Those are where the most of ours come from. Yes, I sent a group of my department heads to an event in Turtle Lake earlier this year. They went to a youth apprenticeship, I don't know, open house or something. So yes, we do have youth apprenticeship. And again, they're usually like really great students. We really like them. So that's nice too. Yep.
And are you seeing any uptick in people interested in jobs as the COVID money is tapering off?
A little, I mean, it's hard to say. We've had a little uptick in the last few months. But I'm sure as you know and hear, with the more of the unskilled jobs, we have a lot of people that come and they maybe come for a day and then we can't get a hold of them, or lots of that. But I don't know if it's directly related to that or more of our marketing efforts. It's hard to say as of now. Yeah. Yeah.
Other questions?
Chair Amy, can you hear me at all?
Thanks for coming, everybody.
Amy, can you hear me at all?
So what you're like, or what that, you're gonna solve the world's problems, you're gonna say.
Yeah,
So,
of course.
Go for it.
Like what you're,
Both
what
ways.
Homepage Manor is looking for, but also like what the industry is looking for. Are you looking for people who, like, what is the track? Like, are you looking for somebody, you said you had entry level jobs, but
Yep.
is it also like CNA? Because this is where I'm,
Yep.
I don't know
Nope.
what the track is. For
Yeah,
people. So, like,
sure.
where's your starting point? Like, who are you looking to keep around?
Right, like is there growth for these positions, do you mean? Is that
Well,
what
yeah,
you're
you said
asking?
like your LPNs are almost fully staffed. did you
Yes,
say?
yep,
So like, what is, if I'm somebody, if I'm a 16-year-old
Yep.
student and I'm looking at like my future and I'm potentially gonna make that, move to Minneapolis, get an
Yep.
education, come
Yep.
back, like,
Mhm.
what does that look like? Like, who are we looking for?
yeah. So do you mean overall in terms of kind of what positions or what? Can I answer your question correctly?
All right, so I'll put it another way. When we were talking with law enforcement.
Yep.
They have a similar problem. There aren't people going to the academy.
Yep.
There's not a pool of people who are
Right.
available to become law enforcement
Yep.
officers. So like, are we facing that same thing where, well, I guess my first question is, what is the track? What is entry level to experience to
Yep.
advancement?
Yep.
What is that?
Yeah, so, the CNAs, obviously the housekeepers, laundry, dietary aides, those don't require any training. A lot of times we do encourage, those folks to become CNAs. But there's some people that are like, no, don't want to, that is not what I'm interested in. You cannot pay me enough, to do that. I want to work in the kitchen. Okay, great. But we do, train those people, then they become CNAs. Then we have the LPN. So an LPN, someone that gets their LPN from a tech school, there's not a ton of job opportunities for the LPN anymore. The clinics are hiring CNAs and MAs to do all of their like rooming and clinic work. I mean, one of my CNAs that was a longtime CNA here, she's actually got hired at the Amory Hospital to room patients as a CMA, but she's not a CMA, she's a CNA, so she can't give the injections. But they're hiring, when you used to go to the clinic, you'd get room by an LPN. Usually it was an LPN that would take you to your room and do all the vitals, but they're hiring CNAs now. So the one thing long-term care has is that we hire those LPNs as a nurse here. They get paid well for the LPN job. And a lot of times, sometimes if they're done schooling at the LPN, I honestly think long-term care is one of the best places for the LPN. But we also have a rule that we have to have 8 hours RN coverage every day. So we can't only employ LPNs to do all of our med passes and all of our everything, because we have to have an RN here at least 8 hours a day. Which Monday through Friday, I have, management nurses that fulfill that, but we also have RNs on every shift, but, so then the RN, basically, the RN and the LPN play a very similar role here, except for their scopes of practice are a little bit different with what they can do. And then in terms of growth, if you're an RN, you have a nurse manager, a director of nursing, and a nurse assessment coordinator. So those are kind of our leadership nursing roles. So there is room to grow all the way kind of up to that director of nursing role in nursing. So like I said, some of those CNAs we've had that are now RNs here, I'm hopeful that one day they do plan to aspire to fill one of those leadership roles here
Goes the ambulance, I think.
where they want to be. Does that kind of go down the right track that you're wondering?
Yeah, I'm just dreaming big about
Yeah.
how we can support schools in their efforts to
Yes.
kind of promote.
Yes,
Well,
And-
and I don't mean to lump you guys together,
Yep.
but like, it's the same problem.
Yeah,
enforcement and
absolutely.
medical staff
Yep.
and stuff like that,
and I
so-
have gone and spoke with some of the careers classes this year, like at Amory, I went over there and talked about the career opportunities here, and I'm more than happy to do that at any of the schools. Our nurse recruiter has set up some of those meetings, and she's new to the industry and everything too, so I've gone and done some of those to try to teach her kind of what we want to say, and because I agree, I would love any partnerships with, even though, those 16-year-old CNAs, we wish they could do all of the
Yeah.
work, but it's still great to have them and again, get them interested in this field, because it's not an ICU, it's not an ER, it's not a OB ward, where all of these new nurses think that's where they want to be. But there are nurses that decide, that's not where I want to be, and I like the long-term care. And, we have our share of paperwork, and I mean, if anyone doesn't know, we're, one of the most regulated industries in the entire, world. So the regulations are not for the faint of heart, but there is still that, connection, that long-term. And that's what one of the nurses that came from the hospital said, you get to see and work with these patients for a couple days a week, and here, you're building those relationships, and you become part of their family, especially, if anyone, we call ourselves the Gamma here, that's kind of our little tagline. And it's true, we feel like family, and some of these people don't have family nearby or family that visits, so it's definitely obviously very different, setting than a hospital, but a lot of those new nurses still want that, acute care. Yeah.
So who's your regulating authority? JCO or?
No, so ours is DQA, CMS throughout federally, and then the Division of Quality Assurance is who comes and does our survey. So our surveys are unannounced every 12 to 15 months. And then they'll also come in periodically if there's a complaint or a self-report or things like that.
So I just did 20 years in as a health and safety professional. Okay.
Yeah.
So a kid can operate a fryer at McDonald's with a camper spot.
Yep.
So so that's where you attack that from.
Yeah.
You go
Right.
You go to your authority.
Right. And that's
Yeah,
what, and we've been doing that since I've been in Lockton for 15 years, and it's always been,
That's a safety device for your employee.
right.
There's
Correct.
no reason why.
Yeah, and it's been, the Leading Edge Wisconsin is our state association for long-term care for nonprofit governmental, so they do a lot of advocacy for that. I was in Iowa before here, same thing. It's just crazy, and it is amazing to me that it hasn't changed, but OSHA has not budged on that.
Well, this is a little bit, I'm sure, they're gonna roll their eyes, but would it all help if you had a resolution from the county board saying, we would really like this button pushed?
Right. Yeah, I mean, it wouldn't hurt. I could reach out to, there's the county association for nursing homes too, and see if they've done something like that in the past. Just to see.
I mean, just keeps the.
Yeah.
Be a nudge.
Yeah,
nudge
yep,
thing.
keeps it up there.
Alright,
Yeah,
we'll talk about
absolutely. Right.
Yeah, I wonder if other counties or boards.
Right, and I'm sure others would go together and
If we
we'd
just
say,
loaded
there's
it all up,
20 some.
have somebody from that,
Yeah.
from that association supporting us.
Right, right.
crafting a resolution that would actually hit all the right buttons.
Yep.
And then if a whole pile of us
Right,
all did it
course,
at the
yeah.
same time, maybe
Right.
it would,
yeah, I'll look into that a little bit.
that would be great.
Julia, would we be able to call WEC with Wisconsin, no,
WCA,
CA?
anecdotes.
And would
Yeah.
that be what, and do you want me to do that, or is that something you guys do, or what do you guys, or we could talk about that?
I will do that.
Okay.
I
so you're
will,
gonna
I
call
will
them and
reach
let
out.
you know?
Yeah.
Okay, okay, 'cause that would be cool if it's not just us.
Because we,
Mhm.
I mean, there could be a resolution that the county board passes, and like we've done in the past, send it to the annual meeting
Right.
with
Well,
WCA,
that
and they
too.
adopt it to lobby that
Right.
as collective.
Right.
You know, and then share it with other county boards, especially those that have nursing homes.
Right.
Those counties that have-
The first thing I'm gonna do is I'm gonna look up the OSHA law.
Yes.
And if it doesn't say anything specifically about patient lifting device,
Mhm.
then I'll use my credential. I'll work with the doctor or
Well, they're
something
gonna
and
write you
Yeah, look at it.
a
'cause
risk
I-
management plan.
Yes, I have it. Yeah, I can find
Good
it.
job.
Yeah.
Yeah, so there's kind of two things. We could do the lobbying side of it, but in the meantime, we could also pass this in the next couple, 3-4 months. And you could use it saying, hey, this is my county. I don't know.
Yeah,
So anyway.
it's worth looking at, yeah.
Resolution is
Yep.
good.
Okay.
Yep, because it's hard when you have after school, you have
Yeah.
3 16-year-olds here. You have to strategically place them throughout the building, and then the over 18 staff get a little irritated.
Right.
They're-
It's crazy to me
Yeah.
that I can go and work at a Subway.
I know.
No, slicer.
But probably has rules too about under six, or I think it's maybe if they're under
Sure,
16.
maybe like 14
Once you get to 16, you
yeah.
can be more.
Yeah,
My niece was there.
yes, yes. Yeah, it's just, I always say, like, oh, they're fun here, and, you know.
Right. So.
And we do, and like with the and with the full body lifts, it's out two, our policy is that it's a 2-person transfer, so they're never alone anyways. So,
Are there other ways they can support you?
oh goodness.
Well, you can also let us know.
Yeah,
I mean, yeah. not
Yeah,
put you on the
no.
spot.
yeah, I will.
Okay, Malia, did you have a question?
I just, so Dana, you and I should have a Teams call.
Sure.
and put some calls.
Sure.
And then I'll draft it for your meeting for next month.
Put it on the next agenda.
I won't be here for that meeting. but I'll have that.
Okay.
Amy, am I on mute there? Or can you hear me at all?
Safeties for the employee.
You
Right.
wanna put me on there. You wanna put me on there?
Yeah, she would be, okay, yeah. let's get you
Right.
I got
I
a
got no,
whole
from
bunch
the-
of.
Here we go.
I just cut you off.
I just rested my hand up. Quick question for you, Dana, with Amory Hospital,
Yeah.
St. Croix Falls, do you find yourself competing
Oh my
with
goodness.
them for
Yes,
your
and
staffing?
that's, I mean, so I'm surprised that didn't come out in my little speech here, because that's been a huge, a really sore spot these last couple of years. You know, the hospitals can pay way more than I can. I have lost some of the best staff ever to these, hospitals, Westfield, Amory, and St. Croix. I can't compete with their wages. And I can't blame people for, looking for that, advancement in their wage. But typically when they're going to the hospital, they're doing, their role is less, or they're more of like, if they work med surg, they're a gopher. The nurses do the CNA work, and it's different. But we're competing greatly with the hospitals. That's who we're competing with. Is the hospitals. I mean, honestly, I have about 8 CNAs just in the very front of my mind that I've lost these last 2 years to the hospitals.
And do you have any idea if any of your CNA recruitment or any of your staff recruitment has to do with lack of housing? I mean,
I
seriously, do
don't
they say?
know. That's a good question. I can't say. The one thing
Because
I will
other
say,
industries can say that that's the
yeah,
case,
the one
so.
thing I will say in terms of housing is with this international recruitment that we're looking at. I have been talking to economic development, because
Right.
they are also in the throes of that. I've talked to Vince about this, our north wing that is empty. I would like to utilize that for short-term housing for international staff.
That's a good idea.
Because, and again, I will show anybody around that wants to, because they're patient rooms, they have a bed, they have beds, they have a bathroom. We have like a shower room up there that could be used, individually. And that's what I would like to do once we get further in this process, because I've talked to other facilities that have done the same. where, you know, for the first month, the nurse may come over, and then the point of the international recruitment is that the whole family comes to the community then. And hopefully there's a spouse then looking for employment, and, you know, they kind of integrate themselves into the community. Cumberland has done this program for years, and they're well established, or Barron, excuse me, Barron. So I would like to utilize that north wing for kind of, whether it's a month, you know, depending on what the pulse is, for how long it takes them, because then they do have to find housing in this community in order to stay here, and they sign a 2-year agreement with us. And they are hired on as one of our nurses, so we're paying them the exact same wage we would pay, you know, any nurse that came to apply. They would get that same wage, and they would be one of our staff, not a traveler, not a contracted staff. They would be one of our staff. Wages, benefits, everything would be the same. They sign a 2-year agreement with us. And then according to Barron, typically, he said, you know, these people have a huge loyalty to you in the facility because you brought them here, you helped them, you know, integrate into the community. They build these relationships, they typically stay with you. Some of them don't, of course. They may get here and decide to move elsewhere because they have another family member who's working, you know, maybe in Milwaukee or, you know, wherever. But so that's kind of on the housing standpoint, what I'm looking at doing down the road when those folks come.
So that piece between when they have to move out of the north wing.
Yes.
and their own home, that's where it's all.
Right.
Yeah.
Yep. And that's the piece, yeah, that I have talked a little bit with Amory Economic Development and what, because they want to, there's other industries in Amory that want to work with international recruitment as well. And how are they gonna help us solve
And
that?
there's
What's that program called?
There's
It's
17
called
million
PERM,
displaced.
it's International Manpower is the company that we're working with. The PERM stands for, I'm not gonna remember now.
Sorry.
Yeah.
You
you
guys
can look it up.
get you get education around for your money with acronyms.
Yes, absolutely. So yeah, these healthcare workers are out in the Philippines. They don't have, you know, the Philippines' greatest export is their healthcare staff. That's what they, otherwise, these folks are going to places like, Israel and, you know, places that they have to go by themselves. They don't get to bring their family with. They are gone for 2 years at a time. They're sending their paycheck back home, where when they get to come to the US, that's when they've kind of made it in their, you know, healthcare track, and they get to bring their families and become part of our communities here. So, yeah.
Deep dive.
Right now,
That was a good extra question.
Yeah.
Yes, and it gets back to the housing.
Yeah, right. Yes, so I do see a need at that point for us. And I know a lot of those people like to, they live in larger, maybe family units than we do, but still need housing.
Right.
Yeah.
Anybody else? Okay, Don. Number 8 on our agenda, the budget review for 2023.
Chair Middleton, would it be all right if I cover both agenda items 8 and 9?
Oh, sure, yeah, that's a good idea.
You
should ask the person 60 minutes.
Which one are you?
Persons.
Go slow.
I'm just kidding.
I'll go slow. Well, thanks for giving me the opportunity to be here today. It's been about 6 months since I've been at GAM. So I'm going to try to contextualize what we're doing with, are you tired of budget yet, by the way?
Have we heard anything about the budget since you guys? I don't think so.
It's been at least a month. Well, I'd like to sort of put the budget in an annual context today, if I could. So for each of the last 5 times that I've been before you, we've been sort of taking a 800-meter sprint each time. And the end goal is to produce a budget for the county. And the sort of user-friendly-ish version is this budget book. And you had an opportunity to pick one up or have one emailed to you last month. That was a draft. So this is now finalized. And if you'd like to have half a pound of paper, I will be happy to provide you with one. If you'd like to have the updated complete final version, we'll be happy to send that out to all the committee members in a very lightweight digital file. So what's in this thing? If you haven't had a chance to look at it, it's a really high-level view of the departments and organizations that your committee has oversight October. So Dana and Janet, is she in the room right
She's
now?
not.
We worked,
Yeah.
and numerous other folks worked long and hard to help Dana. They're an enterprise fund, so they're a little different than the department, but figure out how they're going to run for the next year. So the budget is the de facto operating plan for all of our departments and organizations. And the board adopted that de facto plan last November. This is the result of it. So I'm here today to say, if you want to learn more about what's in this book for your departments that are under your purview, or the enterprise that is under your purview, finance is ready to help you do that. Not just with the information that's in this book, but we can dig deeper into the income statements, try to really understand what's going on. Some of the issues that Dana talked about today. Finance team is here to help you do that. If you want to do that investigation, that look back, that look into what's going to happen forward with the 23 budget. So that's the budget review. If you'd like to do that, we can help you do that. Why are we offering that right now?
No chances to amend.
Well, there's always a chance to amend. That's right. So if there's things that need to get done that aren't in here, we can talk about that. Try to find the resources first without a budget amendment. But if we need a budget amendment, we can do that. That's exactly right. The other thing, and this is a little bit more painful part, is we actually have to start looking at 2024. Yeah, right. So this is the guide, Bill, I'm sorry, the guide for 2023. But if you think about it, we use this as the basis for building out into 2024. So any questions about why I'm up here today to show this to you? Because I'm going to go to the next agenda item if there aren't any.
Ladies, that's the question. Did that, how much,
Change.
yeah, how much change? Like the narrative side of it and
There
then
is-
can't even different departments?
I think there's an extra paragraph in there, literally a paragraph of narrative that described how we ended up with the budget amendment, not the budget amendments, but the additions at the last board meeting, at the October board meeting. So the administrators' inclusions and then the other inclusions that came from the board itself. There's a paragraph that describes those and the impact on the budget. Other than that, Vince decided he would actually sign it because it's final, and there's an updated map of the supervisors. So there's really not a lot of change. But I'd love it if someone would at least take one copy of the final. That would make our team feel really good. Okay.
I'll take it.
Any other
I'll
questions?
take it.
You're welcome.
Was there any major changes from the draft?
No, sir, there were not, Doctor. There weren't any major changes other than just this explanation. Yeah. Okay. End of year financial reporting. So why would we want to know what happened in the previous year? So we can understand what we want to do in subsequent planning periods. Well, it would have been great to have had a really robust way of looking at year end and even quarterly reporting when we were doing that budget process last year. We really didn't have that. So in a way, we're building a plane in the air for the 2024 budget. And what I'd like to, I think you've seen bits and pieces of this. I showed you a third quarter income statement back in October. And we said we're moving toward this plan where each quarter we'll look at the performance of departments and divisions. And what we can do is we won't have the full year, but we can at least say, hey, how are we doing in third quarter, 22 versus 21, third quarter versus 20, third quarter. So we can do that kind of quarter to quarter comparison. And at the end of the year, we can sew it all up into an annual report. So we've got the 3 quarterly reports, the 4th quarterly report, and then the annual report that'll also trace back for each of the full years and then take into account that budget. So you'll have this past of performance, you've got what's happening in the current budget year, and that'll set us up for planning for, which starts in May, the 2024 budget. You guys can't wait to do that. Field trip sounds pretty good right now. So that's the plan, and we'd like to show you a draft of one of these in February, because we'll be through the January, which will be the 4th quarter of the 22 year. Make sense?
Yeah. What
Clear
is
as
the
mud?
title of the document you're going to?
Well, there'll be a quarterly report, and then we'll sew them all up, 4 quarterly reports and an annual report. My guess is those will come out, the annual report will probably come out in March or April, just in time for our initial discussions of budget in May and June.
I have a question. So since you're building the plane in the air, are you gonna have quarters to compare?
We do, yeah. So our financial, yeah, we've got a really nice financial reporting system. We just haven't, I think our issue has been level of detail. So we have excruciating detail for the people who, you know, are down in the coal mine working, you know, digging a coal and throwing it on it. And then we have very, very high level information, but we haven't had that sort of middle level that allows sort of a interested party to understand what's going on at the right level. We're trying to get to that. So the board has more visibility into what's going on with departments, divisions, and outside organizations, not the super high level view and not the super granular. We'll see if we get there, and you can give us some feedback as to whether we're doing it or not.
Well, I really like how you're doing this budget as a narrative and the descriptions of departments. I'm gonna laugh. All that stuff. Thank you. Questions?
Why are we not having a meeting on Valentine's Day? Valentine's Day?
I can't answer that. I have to.
It's
What is
a
it?
long-held tradition to not meet in February. Would you like to make a motion?
No!
We'll talk about this later. All right, thanks, Don. Okay, number 10, legislative event report. Anything?
No, unless Chair Bonaparte, but I think, or Vice Chair, he's been out of the state, correct?
Yeah.
So I doubt that
I don't think
Mr. Bonaparte has anything.
Okay. All right. And the 2023 work plan.
We just passed that out. This is a draft.
Okay.
We try to do, program review every other month, so those can be determined. I know there were some requests that we're carrying over into next year. The truancy, we would look at doing in March, as requested. Recent request was the trauma responsive agency initiative that we've been working on. A few of the committee members here attended that training, and we want to bring back and be able to tell this committee what that's all about. And there's a fun video that goes along with it. Otherwise, we have our important dates are in there, the public hearing, beginning of budget, review of budget. So I embedded all of that in there. We can add the quarterly financials into this. So I'll send out, or I'll give it to one of my minute takers here, one of the clerks to send that in the next, along with the minutes when we send those out or with the next agenda. But we'll add the quarterly financials, our regular updates from Golden Age Banner, child support, veterans, and community services, along with annual reports. And I think that's pretty standard stuff. The homeless unhoused, I did not include a lot in there, because I don't know if we know exactly where we're going with that for this committee. So that maybe a task force, and we can put that into the work plan, or
Probably. It's it on there once, but maybe that's gonna be
that was the for March. I put that.
priority.
That, yeah. Also the transportation feasibility study will be having the regional planning come up and talk about that.
Yeah, it seems like
I
we
think
should
in
have-
March they'll be ready, if not then April,
Okay.
to present the findings and recommendations.
I would like to see a monthly infectious disease report.
Yep, I have that ready too for you as well for today. We had a COVID standing agenda item on there, so that was at the bottom of this, but if you want the full-blown communicable disease report, we can get that to you. as
Yeah,
well.
let's hold up on that just a second. Anything else on the work plan that people have?
I
Are there
maybe
burning
change
things?
on May 9th. Your,
Oh, you're okay.
Oh, yep.
Was it intended to have June and July both have GAM, VSO, and child support?
One is an update and the other is the annual report. Does that?
Oh, report, gotcha. Okay.
Yes. Okay.
So, but we can, I wanna make sure that the housing piece stays somehow on there. So I don't know if you wanna just kinda, I don't know.
Well, this, so for Gen Gov, we said this is kind of like a shell, and obviously in January we finalize, we can always add to this.
Yeah, and we can always add housing on an agenda. I just don't wanna forget it.
And
Because
I think her point earlier was like, we're kind of at a point where we don't know
I
exactly
know.
what the effort is when it comes to housing, so we
Okay.
kind of need to wait for something to shake out.
Okay,
It may change if come April, the board decides
right, okay,
housing is one of our top 2 or 3 priorities that we're gonna dig into, and then we may, launch a little more investment.
okay. All right. Anything else?
This is a working work plan.
Yeah, no, that's good.
A draft for you.
Yeah. But are there any, program areas that you guys are just dying to know about that we could bring back? Otherwise we can just divide it up and talk about whatever. I mean, we could talk for years on all the different programs that we
Right,
are.
like, I mean, even just.
Tanya, am I completely muted on your end?
Yeah, child welfare, like we could spend hours.
Well, that's a good question, because it kind of lays into what Don, we've been talking about in executive about how the different departments are going to present to the full board, the matrix of information, which is way bigger, higher level than we could maybe dive in a little deeper to different departments.
Yeah, we had some discussion at our directors meeting yesterday about that, and we feel like we might need more than 15 minutes in a year to tell you what we do.
No, for sure.
Yeah, so we want to take that back to Don and
Yeah.
that, like, what exactly, or what does the board want to know about our functions and why we do what we do?
Well, maybe we could in 23 sort of have this committee help own that a little bit, because we don't really even have the big, long conversation, so we can start thinking through the different departments and have this committee get presentations on them and plug our way through it and say, yeah, this is what the full board needs to hear, and then they need to know more about this department. Kind of like we did with the student family, with the children family, the other day.
Children, family services.
Yeah.
What I'm thinking, and, this is just sort of brainstorming, but what we could do maybe is when we see an agenda and it looks a little light, say, okay, this is the one we're gonna act. I think it's one of those things where, because we do this work every day, we don't need a lot of prep time to say, oh, we need to go talk about this topic to the committee. And then if it's something that, you guys can refer that to the county board, and we could look at the months when the county board's agenda is otherwise relatively light. Or, maybe we do it, something once a year in the afternoon and say we're gonna have kind of a potluck overview discussion.
Potluck, yeah, all day long,
Right.
I mean, I do that. My understanding was it wasn't a departmental update or review that was going to county board. It had a different approach to it.
Yeah, we're probably kind of two different
Would it
things.
be okay if I?
Go for it, yeah.
Right, so, the idea behind there's an agenda item, or has been for a number of months, I think maybe even a couple of years, that have been used to relay CJCC program level data to the full board. Criminal justice and substance abuse are currently 2 of the top priorities for the board. And so that information fed into the decision to put that agenda item on. And I think we had done this enough, and there wasn't a lot of change in the number of people that were in those programs who wondered if we could use this agenda item more broadly. So those reports are pretty concise, 3 to 7 minutes. And we moved them to being less, I'm telling you how many people are in the programs, to sort of a more graphical representation of what was going on, so you could really quickly see it. And we were able to do that because of this great new data analysis resource we got. So the question became, could we use this more broadly? One idea, and Tanya and I have only had initial discussions about this. So, every couple of years, the county does a community health needs assessment. Would it be possible to sort of break down all that data into 3 or 4 really important messages for the board to hear? They could see graphically what's going on, get a little bit of information on it, and then let it sort of sit there and you ruminate on it for a while. It's not so much it's going to, necessarily guide you in any particular direction right now. It's important background information about what's going on in the county. That's just one idea that we've discussed, and it may not even be the best thing to do with that agenda item. We've got, up to 12 of these a year, little, 5 to 10 minute chunks within the county board meeting if there's not an overstuffed agenda. And we just wanted to make sure every committee and the divisions that fed up into it had an opportunity to think about what they wanted to see and hear and share with the broader board, folks that aren't sitting around this table, once a month. That's kind of the idea.
No, I love that idea. And Tanya, do you feel like we can do that? Or do you feel like each of your departments, because you're so big, maybe each of the departments have to take?
That's what we're trying to figure out, the elevator speech, so. Because we have voluntary and mandated services, so what does that look like in 3 to 5 minutes? Without too many questions, so that's our challenge, I think, to figure that out, but if that's what you guys want, we will.
Well,
figure
that's my
something out.
next question is this too much paperwork for, I mean, I think it's really important information for the board to know, like, I don't think the board has a clue what this department does much. And
Right. But
I think but I don't want to make too much work for the staff. If it's not.
I don't think it's as much work for the staff because they do this stuff on a daily basis. They
Okay.
know it so well. I think the opportunity for the committee is to get more into the grass, the weeds,
Yeah,
so to
yeah,
speak.
yeah.
As far as the full board, I think an overview, a quicker analysis of a specific area of interest that maybe the staff decides is important for them to hear. The other option, of course, is for every supervisor, if they want to get more into it, come to any committee meeting. But this is the committee, I think, to dig into the deep specifics. Your recommendation then goes to the full board. One could say it would be easy for a director to say, I'd like to go tell the board about what all we do. They do so many great things. It could be about a 3-hour session, So that's why I think we can break it down by committee and then high level at the board meeting.
Madam Chair? Yes. If, the thing that I've noticed, just since being a board member, is how we get into the group as a whole. And proposals that come in from the different smaller groups get shot down. And it's like, we don't even, the board is not even hearing that same message that's going on. And like with the command vehicle. At our board, we had the sheriff stand up there and tell us about it was assistant sheriff or whatever, and all that good information. And then so we're like, yeah, let's do the proposal, and then we take it up to the big board, and they're like, nope. So they didn't hear that message. Same thing with the housing. It was decided, and they heard all that good information in that little tiny in the which one? The Gen Gov. Make the thing, send it up to the big board, and they're like, nope. So that's where I think it needs to happen. Like when we did the homeless thing, and they kept saying, that's the message everybody needs to hear. The one where you can't say no to it, right? Or you can't, or you have a need. Basically, you have a need, right? It's all good and fine to say, hey, we're great. This is what we do. We're great. Blah 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 blah. That's not what we're here for, right? We want to be better. We want to do better, and we want to fix things that are broken. So I think it's the message to weed through all of that and figure out what is it that you want? What is it that you need? And then how do we present it? How do we take it from here, that message that everybody up here needs to hear at the larger group? And that's happened 3 times since just, when did we start? It feels like years ago, but no, not even a year yet. That's already happened 3 times. Where you sit in something and you're hearing this message like, oh, I'm serious. It'd be like, I always use the analogy like, children don't need to wear coats. you know?
I don't think there's
Children
anything,
don't need schools. Yeah, you can't say, how do you say yes to that? How do you say no to that, right? You have to say yes.
I don't think there's anything that we can really do. But I think it's worth kind of voicing that observation that there's a lot of pre-work and a lot of behind the scenes work that goes in from different stakeholders and everything that goes to committee meetings like this one and others within the county. And there's a reason that those committees come up with a recommendation up or down for something. And again, we can't tell anybody we can't force somebody to accept a recommendation or to, accept a recommendation not to move something. But like I said, I think it's worth talking about, how we value community and stakeholder input that gets us to a point of a recommendation and then bring it to a board that sometimes, I'm going to speak probably a little too loosely on this, but sometimes just acts like they know better than the experts that brought us to that point. So yeah, it's just I'm with you.
Yep, and that's where you give them you give them the proposal or the resolution. And you have Connie stand up there and give them that one piece of information that you say no to this, you're not doing anybody any favors. You're not doing the community. We worked hard on this. And this is the primary reason why. It's that piece of information. We didn't have that, Ryan. I was just thinking to the latest one, and you stood up and were frustrated. What's his name? Got up, discussed the left room. And that should never happen again. And if you do it right, when you're making that, you're presenting it to the committee, you need to present it with the information that's been weeded out.
But you have to remember, never confuse an issue with facts.
Right. I've never seen a
But that's
statistic
my
I can't
point.
manipulate.
I'm not a planning board member, but I can say that. But you don't want to confuse it, especially with facts. Because a lot of people don't like those facts.
Right.
So one other comment. So if I go, I'm playing again the devil's advocate here. So if I go to the county website and I want to know what a department does, will I be able to find out, since I have it listed in front of me, a department summary, who runs the department, what their services, who they provide, etc. Is that on the new website?
So within our division, we do have for each department, and it does have the manager listed. At one point, we did have all staff, but we decided to take that off just for other reasons. So the managers, our directors are all listed on there, and there's a general synopsis. But the hard part is, I'm going to say DCF, we keep kids safe, but that is so much more than that. And I don't know how you can, without providing too much information and bogging people down. I think we're still in a work in progress, but yes, you can get the general gist of our departments and who you can contact for CSD now.
Right.
That's one.
The reason I say that is, going way back, I printed this off. So what I've done is to do my homework for this committee, I go to the state level and see, what are the state statutes that provide for this committee? That's number one. Number two is, and I'm going to go to the county website and I'm going to see what services you provide and what you actually do. Is there a mission statement? What are your goals, etc. The last thing I want to see is what services you provide. And then if I have questions on one of those services and you do a good job of that already, and I give compliments to the people that are the directors of those different services, because you allow people to come in and they basically sell their wares. Who am I? What do you do? How long have you been doing it? And then what are the facts and statements that go with each one of those departments? So one of the things that we fight with, we don't fight with it, but we have questions on it, is the work plan. So when you come up with your annual reports, it's always nice to have those people come in from the various departments and say, okay, I'm juvenile justice. I'm just going to turn the page here. So under Department of Children and Families, Adult Protective Services, Child Protective Services, Economic Support, Family Services, Foster Care, Juvenile Justice, what do you do? So if I have a question coming up next, April, I'm going to say, okay, so under juvenile justice, how's it going? How many cases have you had? What's the main theme that you're seeing going through? Those are the things that I'm interested in. that go with that department. And then, as I said, you guys do a nice job of doing that. I want that to continue. The work plan is just a work plan. Add something in if you want to see a specific. So again, I'm looking at it from the old, I've been on this committee long enough to know that it changes when directors change, when employees change. There's a pyramid. Okay, so if I look at corporation counsel, I know Malia's on the top of the pyramid. Okay, and so who's underneath you? What do you do, etc. So if you put it out on the website, and I have a question that I want to ask on something from Child Protective Services, I know who to go to, and then I can have the information brought back to this committee. I think it's important that we know that. So it's just an improvement on each month of doing that. Okay, I got my 10 cents in. Okay.
Thank you.
In that line, I wonder who is the director of the health department?
We just have an offer for accepted. It was interim. Helen Swanson did take the permanent position. Oh, she did. With that, there's a little bit of a caveat that she has some credits to obtain, graduate credits to obtain. So we're giving her 2 years to get those. In the meantime, I will be appointed by the state as the health officer because I do need the credential to be the health officer. So some delegation happening there, but her and I will work in tandem with each other.
Will she come to this committee to
Yep.
report?
Yep, and I talked to her about it today. There's a lot going on, so she does plan on next month attending.
I feel very frustrated by not having a health department director giving us reports on a monthly basis.
Well, that's great. That she'll be here.
Yeah, that's good. So, okay, so not to single out the health department, do you want Department of Children and Families and Behavioral Health here every month as well? Because it's just as important what they're doing.
I would agree with that.
Yeah, I mean, so if we have health department, I would consider, if that's what you guys want, we will make sure, Lisa's good about attending, Kathy. We'll make sure Lee and Helen are here too, to give an update.
And if they're not here, they can have one of
I
us.
could have a delegate.
But I
That's
would
what I
say,
was gonna say, if
it would
you're
be
so
great.
busy, if there's a simple way to delegate. I think the point is to get the information.
Yeah.
If we need more information than we can get from the delegate, we could call a person out.
So I would be the top delegate for those
Yeah.
people. So are you asking for a monthly report from each of the departments on what's happening in the department?
That's a lot.
That's a lot, yeah, no.
Yeah.
I'm trying to lead them into that, it's been writing for you. Like,
No,
Okay, so what I'm understanding is that you're, is that if the health person is here every month, that is, it's an implication that everybody else should be.
It's a question for you guys.
So I guess the communicable disease, I'm just gonna speak as, I work business and operations, so we support everyone else, so we are all kind of linked in there, but if we're saying that the health officer needs to be here to provide, is it that you want a communicable disease update on the thing, or is it that you want a public health update? I think those are two separate things, because if it's the department update, then I would agree with our DCF to
And
equity.
Golden Age Manor.
And
child
veterans,
support,
right,
and veterans, because they all report to this.
I would like a 5-minute from Zita,
Okay, there you go.
which is
Yeah.
a reasonable request.
yeah, it's a good priority.
So does that
Priority.
feel okay that then you're not getting into all the different department heads and then you're feeling if we have just the infectious disease, communicable disease?
You could provide that in her stead. Right.
You could provide it in written form also.
You want it in written form?
No, doesn't have to be.
You're just saying if you want it to be flexible, Arnie, that's what you're saying, right?
Yeah, she could be flexible.
Okay. Does that make sense? With money.
Does that make sense for you guys as a committee?
I think so, but I think then, because it does loop back to this whole hearing from all the different departments, which we're gonna start doing in 23. And then, but I don't feel like there's a need if we have one piece of the public health
oversight to come that all the other department heads have.
The other thing that we offer too is that orientation every 2 years. Is that something that should happen every year because we are so big and complex? Once a year, you guys come in and get the refresher in your off election years.
Well, that's an interesting concept because people will have been here now a year. So a better feel for, what do you guys think is, you want it again? It might kind of,
We send you home with those packets.
it's good.
The booklets.
It's really good.
Yeah.
Programs and some change too, so it might not be bad to do it.
Might not be a bad idea,
I
just
like
because
that.
also it's having been here a year, seen things that might be smarter about what to ask. The fire hose, the first year, like,
Right.
wow, that's a lot.
Right.
Like updating that slide for the.
Yeah,
And
when
then-
when we bring them in early for that.
Yeah.
7:30. So that would be in June, I believe, that we would do that orientation or reorientation.
No, I was kidding.
No, that was a joke. That was a joke. That was a joke. That was a joke.
He gets worried. I just went because our meeting moved early. I was kidding. Yeah.
That's good.
And I don't know along the lines of the meeting time, or next month we'll be back at the government center, is that correct?
I would think next month we'll be back in the government. center.
And we'll be switching to an 8:30 meeting for this committee then, once we were
I
back.
think we
at the
stuck with
government
9.
center. 9 o'clock.
I think-
for-
Are you okay with 9?
I am, and like I said, it's always
Let's
earlier
do
the better, but it,
Okay.
9 o'clock we'll stay at, or either we won't move to 8:30.
Okay, 9 o'clock. Okay, so do we have anything else on this, work plan topic?
Take a quick second.
Okay, subject matters for next month. I have this resolution draft that Malia will give us. Maybe we can talk about the field trip or something to get that going. That was
just
all
keep housing on there,
housing, yeah.
because, you don't know if it'll be ready for meeting or committee meetings in January, but
You just want a discussion topic regarding the field trip, not a field trip scheduled. for next.
I don't even know how do we want to go about a field trip? We just do it casually and just say, hey,
Well, why don't we put the topic on the agenda next month and then we can talk about whether it's a notice meeting and.
Yeah, right.
Okay, times we bust it down. So we'll
Okay.
just put the topic of the field trip
Okay.
for discussion.
Okay.
And then what was the thing that you said? I couldn't type that fast.
just keeping housing on
Housing,
there as
right.
I feel like that's gonna be on each agenda, even if it's just a quick update.
And that's related to the field.
Right.
Because we don't know, West Central Regional Planning might have information for us at that point.
Yeah, I should. Something.
I'm gonna get fired as a clerk right away.
Yeah. Anything else for next month? No?
Tanya, that trauma response video.
Yeah. Next one.
So I have that on the work plan with the video. So we will bring our group in to talk about what that means, and then we'll show you the fun video.
Okay.
With some edits, a couple of edits.
What's the video?
And then I can give a communicable video report, trauma response. Yep.
Yes, please.
Okay, so since September 1st, we have had 15 known Polk County residents hospitalized with influenza A. So influenza A is going around. RSV, we've heard a lot about RSV going around. It's not a reportable disease, but it seems like we've reached the peak and it is on the decline. COVID, we're at the medium stage for the county, so it is going back up again. 28% of Polk County residents have received that flu vaccine, 31% statewide, 28% for Polk County, 31 statewide. And then the COVID boosters, Polk County, 15.7% have received the booster and 16.2 across the state have received that.
Yeah, the latest information on infectious disease nationwide is still over 400 deaths from COVID a day. And so I was looking at a map for the United States, and we're actually upper Midwest is kind of low, and the other West Coast, East Coast, other parts of the United States are really, really suffering, and I think, Dr. Fauci, was on TV on Channel 2 a couple nights ago. He said we're seeing the worst influenza season in 10 years. They had a big influenza season in South America this summer. And so we're seeing basically the same thing. And part of the thing that I think helped us in the last 2 years was mask wearing. And so I think that be aware that, I still wear a mask. I go to marketplace and to Walmart, so I'm not afraid to wear a mask. And so I think I would like to, the other thought I had was that one of the things the health department should consider doing is that a lot of our people at 65 over are the most susceptible, as you all know. And most of those people don't go to the county website. And I would like to see if the health department would just send a little brief note about COVID and influenza into our local newspaper and urge people to get themselves vaccinated and get their boosters. So, and it's a little bit of PR that I think that you could help our communities and our hospitals, because in my last conversation with our hospital CEO was that they're really full, and they're having lots of staffing issues and having to hire people from outside to come in and work. And paying a lot of money and I would suspect Amory Hospital, Osceola Hospital, they're all the same.
And we did hold vaccination mass vax for flu clinics. So we were able to capture a lot more drive-through people to get their vaccine this year, along with the booster. So that previous years we would have a walk-in clinic, or we would have a clinic at the church where they had to drive in or pull in and get out. But we did it drive-through style this year, and we caught a lot more people in that way. And then we hit the wall again. So we hold them until the demand stops. And it is just like turning off the water that we're done. So we pull those back. Along with that, we are pulling back our testing because it has been super slow. There are resources. The government, you get the 5 tests. We have 3 tests at our front desk. People can come and get those. So we're really going to encourage people to do the home testing. And with that, you're supposed to do 2 tests for reliability. So if you get a negative and you still have symptoms, you should test again, because there might be
At the same time, like back to back, they have 2 tests in the kit that you get.
So use them both.
But it's like within
Waiting hours.
Yeah. Vince, we did that last, remember we did some outreach in the papers? So when we had our drive-throughs, we did do other publications. We put up flyers, we kind of worked with FADRC. We did put stuff in when we had our drive-through clinics. But not just.
We didn't do an individual mailer though.
No.
That demographic or the whole county.
I think we was going to go to the paper. So I think we have put stuff in the paper about our clinics, but not just, we're not holding them anymore, but it doesn't mean they can't go to their medical provider to get it. So we can look at it.
Just as a small thing here, I know, since COVID, we've all had to wear masks, all the time. And we used to say, if you didn't get your flu vaccine, you have to wear a mask during the flu season or when we're at high. We can't say that anymore because our staff flu vaccine statistics have dropped significantly also. It's really a struggle to get our staff to get their flu vaccine because we don't have that.
They have to wear the mask.
They have to wear their mask anyway. So they're like, well, what's the use? Which of course there is, but
It's not mandated.
right, it's not mandated, no. The flu shot is not a mandate.
Yeah, well, the only reason I was thinking about a very short newspaper article, as frequently as you can manage, that people over 65 are the ones that don't want their newspaper electronically. They want it paper they can look at, and they don't go to the website.
Yeah, there's probably people under 65 who still like that too.
I mean, I did the newspaper.
I wonder if the, if a letter to the editor from you as a respected healthcare leader in our community would be more effective than the government.
Oh, that's a good idea.
Well, I
Just,
I-
or from, I don't know,
I could do that.
You know, it just seems like that would be, as a, maybe even more effective, because, I mean, I get paper, I read it, but I probably would read a letter to the editor more than I would read an ad.
Yeah,
Yeah.
Okay.
that's a good idea.
So, throw your weight around it, but I think.
Oh, that's okay.
Arnie, which papers are you talking?
Well, I usually read the intercounty leader, but
All of them.
Okay, but that's my point.
Because
We
it's
come down
Amory,
here, you
yes.
know, it's Avery Free Press.
but, you know, when I'm at marketplace, I glance at the headlines on the Avery paper and the Osceola paper.
But it should be sent to each one of those.
Yeah.
I think all of the newspapers need to get that.
Can we provide technical assistance on this? Where
On
he
the press
drafts
release?
it and then we can get it out to the papers? And
Yeah, if he wants to send it to us, then we can
Would you
use
like
our
help with that? Arnie?
expert, and then
Sure.
we've got the online, we can send it to.
It's so easy for us to do. So you draft it and get it to
Send it to me,
Tanya.
and then I'll get it to the.
I'll have her edit it.
Yeah.
What about like the yellow paper?
Yeah,
Those kinds of
exactly.
things. I mean, that, everybody, that's in their mailbox, right?
We have advertised in those, when we've done those things.
I mean, just this letter that we're talking.
But
I
that's
don't know if there's an.
Oh,
That's not really a
Yeah.
newspaper. Yeah,
The
now.
shopper.
And all honesty, I mean, I think since I moved, that thing has, it's like a quarter of the size. and I don't look at it anymore.
I put it in.
I mean, I don't.
Yeah, actually, a stumper.
Leah's leaving. Do we have anything else necessarily?
One of the clerks is leaving the building.
Right.
So you get the motion to adjourn.
Yeah, I can handle that. Okay. Anything else on work plan, PR, outreach, letter to the editors, or Tanya? Thank you. I'll take a motion to adjourn. No, you can motion to adjourn. Second, no, favor. Guess what? All in favor? Aye. All right.